Welcome back to another episode of Dr. Rob, Pain Detective. I'm your host, Dr. Rob Pumahawk. My guest here, Cherie English. We're here to figure out why she's in pain and to provide her with a wonderful solution. She's been on a couple different things in the past, from Playboy to reality shows to Cage Rage Fighter.
Cage Rage.
Right, wonderful things.
Lingerie
to owner of a wonderful Urban X Awards and founder.
Yes.
So amazing guest. Thank you for being here. I appreciate you being here tonight. So let's talk about you. Why are you here? What are we going to figure out? Let's go for it.
Thanks for having me, first of all. I have a lot of pain. My knees hurt. I have tingling sensations in my arms that go from my shoulder all the way down to my fingers. It's random. I could just be sitting and then I'll just start getting this like pain that starts here, and then it'll work its way down and then it starts tingling in here.
It's just happening randomly. You have no idea why.
Yeah, it randomly happens.
So my job is to figure out what the heck's going on with you and then tell you how to fix it.
Exactly. Okay. My knees too.
Always. Have you had injuries to the knees before?
Not that I could remember, but I did play lingerie football. So
you've had some injuries in the past that might have created or caused or contributed to why you have these problems?
Possibly. I mean, I was an athlete. I ran track.
Oh, wow.
I was a long jumper, sprinter. So those could also be possibilities.
Did you have injuries when you were doing those sports?
I did. I used to pull my hamstrings a lot in my quads. So those
are factors as well?
Yeah, those were my two.
And then recently, no traumas to the knees of any kind?
When I decided to go work out at the gym, I jumped up to do one of those to see how high your vertical is.
Sure.
And I came down on my knee.
So you've had small accumulations of trauma over the years,
right,
but we don't know what's happening with the body. There's got to be a rhyme and a reason behind why you're struggling with these problems. So my job is to figure those things out, come up with a solution, help you understand what you can do, and then what we do to fix your problems.
I have good and bad days. There are some days where I'm okay, and then there's other days where I feel like drained and exhausted because I didn't get enough sleep, and then I'm dealing with, depending on what I'm doing, I'm dealing with maybe my knee hurting and then the arm possibility. And if it's both in one day, it's just a horrible day for me. Yeah, I mean, I fight through pain. I try, especially if I'm doing something. Like even when I got my concussion, I got it in the first round, but I refused to give up the fight.
Yeah, what happened there? Because that could be another factor why you're having this problem in the arm.
Well, it was a straight shot to the nose, the first hit.
Did you break your nose?
So no, I didn't.
Yeah, breaking your nose stinks.
No. I don't want to break my
Black
nose.
guys, no thanks.
Yeah, none of that, thank goodness. But I did have a concussion. It was my first concussion ever.
Yeah.
I had no idea where I was, what I was doing, where my daughter was, didn't know where my wallet was.
Weird
I don't
feeling,
know how
right?
I got home. Yeah.
Yeah.
It was a horrible feeling. Like, I mean, we laugh about it now, but it wasn't good.
Definitely, the biggest thing about having injuries is not the first injury, it's the repetition of injuries.
Right.
And your body's not realizing that it's breaking down. Unfortunately, because we're younger, we're athletic, we're strong, we're invincible, right? And then all of a sudden we turn to 30 to 40 to 50, and we're like, what's going on with our bodies? Why can't I be the person I want to be? And then how do I get back to that level? So let's get you being cool again.
Okay,
Fair
I'm
enough?
down.
All right,
I am
then.
so ready for that.
You ready to get started?
Yes.
All right, here we go. What we do and what I do is to help you understand the purpose of today's visit, is to understand the causes of your pain, to provide you with an evidence-based solution, and to create an individualized treatment plan. How do we do that? Well, we're one of the only offices in all of Los Angeles that has a comprehensive approach to understanding pain management. We're integrated. We deal with physical medicine, cellular medicine, and regenerative medicine, all together in one house. So the 4 pillars of pain. What's going on with your muscle system is what's going on with your nervous system, your spinal system, and then your soft tissue. Okay, so the first piece of puzzle that we'll look at is your muscle degeneration. And when we analyze that by looking at your posture, also your feet, because your feet play a role when it comes to knee problems. Considering you haven't had much trauma to the knees, there was no blunt injury, you weren't playing football, no torn ACLs. Why is the right knee bothering you? We got to figure that out. Okay, so let's go and take a look at your posture. So the green line is where you're supposed to be. The red line is where you're at. So in your posture, you're doing a pretty good job here, right? We see the red line and the green line are kind of overlapping pretty much all the way through the process. Good posture, good health. Bad posture, bad health.
Wow.
So instead of bringing your head to your hand, bring your hand to your
To your
head.
head.
Because part of being healthy is understanding what's going on with your body. You see that red line?
Yes.
It's shifted to the
I
right.
see.
Which knee bothers you?
My right knee.
Whoa. Right?
My
We
right
haven't
leg.
evaluated the knee with an MRI. We're not looking at that yet. We're trying to look at the simple things that you can do that's not helping your knees. So eliminate those factors, see if that helps your knee by changing your muscular approach. Now we also look at your feet position. See how your feet are turned in? You're having a supination, but a pronation effect, which means you're turning your feet in. But because you're standing on the right side more than the left side, that's why you have more right knee pain than left knee pain.
Come back.
So the solution for that is putting a pair of insoles in your shoes to help cushion or balance off your flattening of your feet.
Got it.
Next piece of the puzzle is going to be the nervous system. So you see that number 67?
Mm-hmm.
Not a very good number. So now it's kind of making sense that your nervous system is contributing to why you're having the problem in your arm. That's where chiropractic or acupuncture comes into play. The chiropractic adjustment does one wonderful thing, takes the pressure off the nervous system. This disc right here, or these bones right here, are they putting pressure on the nervous system? We don't know yet. We just know there's pressure on the nervous system, so the solution for that is the chiropractic adjustment. So to recap, when it comes to the nervous system, what we have to do is we have to nerve degeneration treatment, chiropractic adjustment, or acupuncture, depending on what you like, right? So now we're going to look at your x-rays. Your neck is pretty flat. You see that?
Yeah.
It's not where it's supposed to be. When you have a loss of curve like you do of more than 70%, look what happens to those bones. They approximate, they put pressure on that disc, that puts pressure on that nerve. We try to minimize stuff as adults because you're like, yeah, I don't want to bother with that, I don't want to bother with that. But you know what? If it's affecting you, you got to figure out why.
Mm-hmm.
But we still have a bone problem. Your bones are still not aligned in the proper position.
Yeah.
Make sense?
Uh-huh.
And then also at C5 and C6, you're having arthritis.
Really?
Yes. So see that bone spur at C5 and C6? That's arthritis.
Yep.
So the arthritis takes a long time to get there. And that's a very common injury when you're having a concussion from whiplash. 90% of us have some form of brain trauma or trauma to the neck or whiplash. We don't remember. So once again, your spine is older than you'll look.
Oh, Jesus.
So now we have to figure out, how do we fix the structural system of the spine? I'm one of only 1,800 doctors in the world that works on spinal correction. I've got to put your spine back into place. If you don't take care of this, you know what happens in the future? Your spine gets worse and worse and worse.
Right.
So either take care of it now or you take care of it in the future.
I don't want to have surgery.
Now, the last piece of the puzzle is the soft tissue degeneration, right? Telling you that you're definitely having some instability factors that were caused by trauma. According to the above biomechanical assessment, there are findings of alteration of motion segment integrity at the following levels: C1, C2, C3, C4, C6, C7, that controls pain going down the arm we saw earlier. Consequently, this patient, you, may be rateable for a permanent injury upon reaching maximum medical improvement. So I'm fixing the muscle, the nerve, the bone, helping with the disc, but the ligaments, I can only manage, right? I have to have a specialty doctor, regenerative medicine doctor, analyze your x-rays, then have a special radiologist, pathologist, radiologist, analyze your x-rays for ligament stability. Then we gather the x-rays, the MRIs, we discuss it, then the information goes to our expert radiologist, regenerative medicine doctor to figure out how to fix those things.
Gotcha.
What do you think? You're on board?
I'm on board. Yeah, I need to get back right.
I got your back.
All right. Cool. Well,
Pleasure
thank
having you. I appreciate you coming here.
I learned a lot.
And
Thanks for
in 8
having me.
weeks, if you want to work with us, we'll reshoot all this data. We'll go over that information again, and we'll tell you how much better you've gotten. So to recap the injuries of my guest today, Miss English, she came in with a chronic history of right knee pain from a bunch of different sports injuries. Not anything major, but she's having a hard time moving, bending, being active. Can't even participate in her track career with her daughter. She's also suffering with neck and shoulder issues and numbness in her hand, where she can't feel her hand. It's been going on for about a year, progressively worsening, doesn't know why, comes on once in a while, and wanted to know the reasons why. So what we did today is we analyzed the 4 pillars of pain: how the muscle system, the nervous system, the spinal system, and these soft tissue systems, degeneration instead of regeneration, are contributing. So the solution for those things are all in our office. We take care of the muscle system by fixing her posture, balancing off the muscles, getting her a pair of insoles or orthotics for her feet because they're also contributing, right? Then for the nervous system, inflamed degeneration, we have to do either the chiropractic adjustment or the acupuncture sessions. For the spine degeneration, we take a look at the decompression therapy for the compression of the discs because of our arthritis and also her loss of curve. Then we also have the spinal correction therapy, which I specialize in, to put the bones back into place. Then we also saw that she's having soft tissue ligament instability damage. How do we assess that? By getting an MRI shot with a specific radiologist that doesn't just look at the simple things, but digs deep into understanding how soft tissue is participating, contributing, ligament damage on an MRI, and then having a consultation with our regenerative medicine expert. Full health in one location. Her treatment plan would be a couple times a week. Every visit's about 40 minutes. We take care of all the pieces of the puzzle twice a week for 2 months. After her 16th visit, I would reevaluate all the factors that we shot at the front end, her posture, her feet, her nervous system, and her x-rays, do a pre and post comparative study to see how better the causes behind her pain have improved. Problem solution, using evidence to figure out your problems. No more guessing. That's why I'm Dr. Rob, Pain Detective.